Namaskar दोस्तों, welcome to channel Toxicology on board. In this video, we'll be discussing about DABT topic, Buller and maximization assay, delayed contact hypersensitivity. So let's directly dive into the question. The question is, what do the Buller and maximization assay characterize? So we need to identify the characteristic feature of this particular assay. So in case of allergen, skin sensitization or hypersensitivity, reactions, no, there are some kind of specific essays are there. GPMT essay, LLN essay, those essays, the principle and which essay is indicating what kind of inference that we should be able to know. So in this particular video, we'll discuss about Buller and maximization assay. Let's see what are the options we have. Option A is mini pig respiratory efficiency. Option B is potential of a product to produce skin irritation. Option C is ribosomal transcription efficiency. Option D is delayed contact hypersensitivity. The right answer will be in the green text, which is delayed contact hypersensitivity. Okay, so let's see what is the explanation and the reference which is given by the American Board of Toxicology. The Buller assay was originally developed to test for moderate and strong sensitizers, contact sensitizers using guinea pigs. So the test species is guinea pigs. The idea behind bringing this assay was to identify mild, moderate type of contact sensitizers as well as strong contact sensitizers. Okay, while the guinea pig maximization assay test was designed to maximize the sensitivity of the test utilizing guinea pigs. So there is another assay, another version which is guinea pig maximization assay was to identify, maximize the sensitivity of the test utilizing this particular test species, that is guinea pigs. Both techniques are used to assess contact allergies, and reactions are typically scored 24 to 48 hours after challenging or re-challenge. So for this, the reference which is given by the American Board of Toxicology is, please go back and read Hayes 6th edition. Hayes Principles of Toxicology textbook is their 6th edition, page number 14472 to 1448. So these are the two specific pages in which they have discussed. I try to look into I do not have the same edition Hayes, I couldn't get it. So in generalized way, I discuss about this particular Buller and maximization essay. So yeah, I got it from 6th edition. Sorry, I got Hayes Principles of Toxicology, 7th edition. I'm having in this. I have given the references. Please go back and check page number 1567, 1973, and 1974. This is a table which is given in given 29.4. So in this, where they have discussed principles and features of guinea pig maximization. Guinea pig sensitization assay. They have Dray's test. OET is there, then we have Buller assay, fraud adjuvant test again, FCA test is there, optimization test is there, split adjuvant is there, guinea pig maximization assay is there. So this video we are discussing about Buller assay, right? Number in test group. So keep this table, memorize this table. So, but now I'll discuss only in Buller assay. Number in test group is 10 to 20 guinea pigs. Number in control group is 10 to 20. Here we have induction phase. Induction phase, exposure route is through patch. Number of exposures is 3. Duration of each patch is 6 hours. Concentration is slightly irritating. Test group is test substance. Then we have a control group, vehicle only. Site for dosing is left flank on the guinea pig. Frequency of exposure every 5 to 7 days. Duration days is 0 to 14. Miscellaneous, that is 9 exposure version. And rest period, exposure route के बाद induction phase, after that rest period is for 15 to 27 days. Then comes your challenge phase, in which exposure route is through patch. Number of exposure is 1. Duration of exposure is 24 hours. Exposure days is 28 days. So FCA was fraud, complete adjuvant, and okay. So these are the things. As we discussed about Buller essay, no, also you read about Dray's test also. How the, if there is induction phase or rest period or challenge phase is there, how GPMT, this guinea pig maximization essay is there, that also you see. Okay, so it's a very good table that all type of essays have come into one concise one particular table. So let's see what else we can learn about this Buller assay. This Buller and guinea pig maximization test are both animal-based methods for evaluating skin sensitization potential, but they differ in their procedures. So what is the difference between these two procedures that we will see? The GPMT uses an adjuvant, okay, and intradermal injections to sensitize the animal. First of all, the animal was not at a sensitized stage. So by giving this intradermal injection, you have to first sensitize the animal, while the Buller test uses only topical application occlusion for the induction phase. Whereas in the case of Buller assay, to introduce the induction phase, you are doing only topical administration. In the case of GPMT, you are giving intradermal injection. The GPMT is generally considered more sensitive when compared to Buller assay. This is again important point that I have to remember. Which of the following types of assay is more sensitive? Like this, they will ask. Especially for weakly allergenic compounds. So those chemicals which are weakly allergenic compound, if our assay is not sensitive enough, we'll think that the particular chemical is not sensitized molecule. But if we use a GPMT assay, they will able to detect even the weakly allergenic compounds. While the Buller assay may not be more suitable, maybe more suitable for strongly allergenic compounds and involves less invasive procedure, because here in the case of GPMT, intradermal injection is given. Here it is topical administration is there, no? That is why animals will be less painful. That is less invasive procedure is also it is there. So let's see what is the important principle of Buller assay. Procedure, sensitivity, usage, and regulatory status will discuss. Procedure is guinea pig are repeatedly exposed to the test substance through topical application with occlusion for a period of time. Okay, after a rest period, they are exposed to a second phase, that is challenge dose. Sensitivity, this Buller assay can identify significant contact allergens, particularly strong ones. Okay, uh, correct, right, absolutely right. Because the less sensitive weakly allergenic can be done by GPMT also. Usage may be more, Buller assay may be more suitable for substances that are strongly allergenic, right, where a high degree of sensitivity is not needed, and to minimize exposure to the test animal because it is less invasive. And regulatory status described in OECD guideline 406 and US EPA guidelines. So 406 is for skin sensitization assay is there. Acute six pack में sixth guideline 406 is that very important. Please go and read in detail about OECD guideline 406 for skin sensitization. So let us understand the major differences between the GPMT assay and Buller test. So the induction method in the case of GPMT is intradermal injection, okay, intradermal injection with the adjuvant, okay, followed by topical application. So in order to introduce the induction phase, you are giving intradermal injection, okay. Second, whereas in the case of Buller test, the induction method is topical application with occlusion. Second one is sensitivity. If you look into GPMT sensitivity, GPMT assay is more sensitive, especially for the weakly sensitizers. So weakly sensitized molecules can also be identified by using the GPMT method. Whereas in the case of Buller test, the sensitivity, it is less sensitive than GPMT assay. So if a question comes, you have to identify which is the most sensitive, means you have to go for GPMT. If you are a study director and you want to go, you want to be more confirmed about particular chemical is sensitizer or not, then you have to go for GPMT assay. Then challenge method topical application in the case of GPMT, whereas in the case of Buller test, it is topical application with occlusion. And coming to invasiveness, GPMT more invasive due to intradermal injection, whereas Buller test is less invasive. So this is the basic principle of the GPMT assay. So hope from this video you were able to learn about the contact sensitization, the sensitivity of the assay. Three assays are there with respect to sensitization. एक तो coming to when it comes to topic of sensitization, no, I'll give you some important point that you have to read. First, read all the four types of hypersensitization: type 1, type 2, type 3, type 4. Okay, which of the following is mediated by what type of antigen or antibody? The basic mechanism you read, and also you read about the examples. Anaphylactic reactions comes under what? Good Pasteur syndrome comes under what? And penicillins are there, they are causing what? Hives. So these are the things, examples you have to remember, which are causing which type of hypersensitive, which of the following is cytotoxic, which of the following is immediate type of that you have to read. And next important thing is read skin irritation. skin corrosion and skin sensitization. These three types you understand, which is one is irreversible, what is causing permanent damage, that comparison you read. Coming to skin sensitization, read about LLNSA, read about GPMT-SA, Buller test, FCA test, all these types of. The table is there, try to memorize it. So these are the things that can be helpful in the exam. So thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. Namaskar. All the best for your exam.